everyone. Thank you very much for the kind introduction. And I would like to thank the organizers of this meeting for providing me the opportunity to give you an update on the SARC Catalyst Award that is focused on monitoring treatment response in patients with leiomyosarcoma by multi-omic liquid biopsy assay. This audience is very well aware that evaluation of response to treatment in patients with leiomyosarcomas may be problematic. This is because it relies mostly on the measurement of the largest dimension of the tumor, which may not necessarily resemble a response to treatment even if the tumor cells are dying, because those tumors are heterogeneous in composition. It may be also difficult in some instances to distinguish between small active metastases in the lung from non-specific small lung nodules that may be visible by imaging. We propose that blood-based testing may help resolve some of those challenges. This is because blood testing is already broadly used in clinical care. It is affordable, it is highly accessible because it relies only on a simple blood draw that every one of us underwent multiple times in their life. And when we use tumor type specific markers for this type of testing, blood-based testing can be also highly accurate. It has been demonstrated in many different types of cancer and sarcoma that tumors shed DNA into circulation, and those DNA molecules in the circulation carry the same types of alterations as DNA in the tumor, and this includes point mutations, DNA copy number alterations, chromosomal rearrangements, or DNA methylation markers. And it has been demonstrated that monitoring of the levels of circulating tumor DNA have many potential clinical applications. This includes early detection of cancer, non-invasive genotyping, especially when traditional tissue biopsy is problematic to obtain. Detection of circulating tumor DNA after surgical removal of the tumor may indicate the presence of minimal residual disease, and it's also useful for evaluation of response to treatment to longitudinally monitor the levels of circulating tumor DNA during adjuvant treatment. When we wanted to design a liquid biopsy test for leiomyosarcoma, first we had to take into account what is the genomic profile of those tumors. And in this graph, you can see the median levels of somatic point mutations in the y-axis and median numbers of DNA copy number alterations in the x-axis in different types of tumors that were studied within the Cancer Genome Atlas initiative. And as you can see, both soft tissue leiomyosarcomas, ST-LMS, and uterine leiomyosarcomas, ULMS, carry kind of intermediate levels of both point mutations and DNA copy number alterations compared to other types of cancer. For this reason, in our pilot study on liquid biopsy assay in leiomyosarcoma, we decided on a combination approach to simultaneously profile both point mutations and DNA copy number alterations. In that pilot study, we analyzed longitudinal plasma specimens from 7 patients with leiomyosarcoma, and with our combination approach, we were able to detect circulating tumor DNA in over 70% of samples in 6 out of 7 patients. Our analysis was characterized by high specificity, over 98%, and we were able to detect mutant allele fractions down to 0.01%. This pilot study demonstrated that the levels of circulating tumor DNA correspond with response to treatment in patients with leiomyosarcoma. Here's an example of a patient who was diagnosed with leiomyosarcoma of a lower extremity, and this patient had bone and lung metastases present at the time of the first blood sample collection. And as you can see, circulating tumor DNA was detectable in the first blood sample from this patient, both by CAPSIC that we applied for point mutation detection. This is represented by the dark green line in this graph, and circulating tumor DNA was detectable also by the analysis of DNA copy number alterations by shallow whole genome sequencing, and this is represented by the dark blue line. After the first blood sample collection, this patient started chemotherapy and radiation therapy and initially responded well to this treatment. And as you can see in the second blood sample, during this time, the levels of circulating tumor DNA became undetectable. However, later with development of new metastatic lesions and with progression of disease, the levels of circulating tumor DNA became detectable again. Here is an example of longitudinal profile of another patient that was included in this study, and this shows that our combination approach actually helped us avoid false negative results at selected time points. As you can see in the last blood sample analyzed from this patient, Circulating tumor DNA was detectable only by the analysis of point mutations, by CAP-seq, but we were not able to detect any DNA copy number alterations. However, in the third blood sample, if we used only CAP-seq, then we would have called this time point as negative for the presence of circulating tumor DNA, while we were actually able to detect some DNA copy number alterations, tumor-derived DNA copy number alterations. So this proved that our combination approach for simultaneous detection of different types of markers may strengthen this approach. The results of our pilot study were very encouraging, and in the next steps we want to refine this kind of assay, and our goal is to further increase the sensitivity of detection of circulating tumor DNA, and we plan to do that by incorporating another type of marker that can be profiled in circulating tumor DNA. And our ultimate goal is to confirm clinical relevance of this type of testing in patients with leiomyosarcoma. As another type of marker that we are interested in incorporating into our liquid biopsy assay is DNA methylation. The most common form of DNA methylation is 5-methylcytosine, and this type of modification can affect expression of different genes without actually changing the nucleotide sequence. And it has been, we are in particular interested in DNA methylation because it has been shown that different types of normal tissues and different types of cancer and sarcoma have highly specific DNA methylation patterns. This has been demonstrated also for sarcomas, as you can see in this graph from the paper that was published in Nature Communications in 2021. Different types of soft tissue tumors have highly specific DNA methylation patterns. This includes leiomyosarcoma that are highlighted here in the red circle. And for this reason, we hypothesized that incorporating DNA methylation profiling in circulating tumor DNA, in addition to detection of point mutations and DNA copy number alterations, will allow us to further increase the sensitivity of our assay. Within the SARC Catalyst Award, we are proud to develop this new multi-omic approach for simultaneous detection of point mutations, DNA methylation, and DNA copy number alterations. And the goal is that we would be able to detect those 3 different types of alterations from a single blood sample, from a single extraction of cell-free DNA. This project benefits from expertise of experienced collaborators. This includes Dr. Matt van der Rijn from Stanford, Dr. Kristen Ganji and Dr. Patrick Schofsky enroll patients for these studies and contribute samples to the study. We also collaborate with Dr. Benjamin Habe-Keynes on data analysis, and with Drs. Rebecca Glady and Adam Schlien from Toronto. Our initial capture panel for detection of point mutations in patients with leiomyosarcoma in circulating tumor DNA, that panel was based only on 79 exomes from the TCGA project. At that time, there was no other exome sequencing data from patients with leiomyosarcoma available. So currently for this project, we identified new data sets, either published or unpublished ones, and this allowed us to refine and validate our capture panel for detection of point mutations in patients with leiomyosarcoma. For this project, we also generated new large DNA methylation data set that allowed us to identify leiomyosarcoma-specific DNA methylation signature that we'll use for our liquid biopsy studies, and we used TCGA DNA methylation data to validate this signature. And within the SARC Catalyst Award, the studies are ongoing. Currently, we are optimizing the sequencing protocol. And in the first aim, we'll analyze tumor, plasma, and germline DNA from 9 patients. This will be longitudinal plasma specimens. And analyzing tumors in parallel will allow us to calibrate our method for detection of true tumor-derived variants in plasma DNA. And in the second aim, we will validate our approach by using longitudinal plasma samples from over 30 patients, and actually we keep obtaining access to new samples for this project. And with that, our goal is to validate that this kind of testing would be applicable to any patient without necessarily knowing the molecular profile of the tumor of each patient. And we envision that the first aim will be completed by the end of this year, and the second aim will be done by the summer next year. Future directions after completion of the research within this Catalyst Award will include further validation of this approach, especially we're interested in applying our technology in correlative studies for clinical trials, and also we seek to further validate this approach, ideally in large prospective studies. Within the SARC Catalyst Award, I was very fortunate to obtain coaching from Dr. Kayla Torres, Dr. Jonathan Fletcher, Dr. Adrian Marino Enriquez. I was able to practice preparation of pitch deck presentation that we have done with the LMS Sarcoma Direct Research Foundation, and I obtained training on intellectual property protection and biostatistics. And I was also very fortunate to be able to join the SARC Discovery Translation Committee meetings, which was very interesting for me. And I'm very grateful for the funding that I obtained for this project from SARC, LMS Sarcoma Direct Research Foundation, and also matching funds from the Montreal General Hospital Foundation. And I want to acknowledge that the studies that I presented to you today were possible thanks to huge effort of multiple collaborators from several institutions, and now I'm happy to continue working on this project at McGill. I would like to thank you for your attention, and I will be happy to answer any questions.